Hi, this is Dr. Katie from Craig Chiropractic and Kinesiology, and this is part 2 of our discussion on neck pain. So in the first discussion, if you were around for that video, we talked about common causes of neck pain, either fairly traumatic injuries or more minor micro traumas, repetitive type injuries here. Okay, we talked about different ways that as chiropractors we adjust the neck, either manually with our hands or using tools and instruments like an activator. Both are appropriate and both are good adjusting styles. Sometimes they depend on patient's preference and also the doctor's personal choice and skill level as well. So what else can you do for neck pain besides just adjusting? Many things. Often there are muscle tightness here or even sometimes muscular weakness. So there may be muscle work that needs to be done. Sometimes we need to strip out the muscles in the neck, almost do like a massage or different muscular therapies. Okay, myofascial release, trigger point therapy, even acupuncture, dry needling. These are all good, appropriate therapies which can be great. Now, sometimes we also need to muscle test the neck. So I'm an applied kinesiologist, meaning that I use a lot of muscle testing. Now, I'll go into that more in depth in some other videos if you go back to my channel, but basically I'm looking for muscles that function properly. I want to make sure like an arm can function. If I'm going to go ahead and put a little bit of pressure on a patient's arm, they should be able to resist that. They should be able to push back into my gentle pressure. If I go to push and a patient can't do it, something's wrong. That muscle's not working properly, and we want to figure out why. Now, sometimes that weakness could be caused by an actual injury, right? Like maybe the arm's injured or the muscle's injured. Sometimes there could be a nerve interference, like a nerve up in the neck, or just like the yellow nerves here could be pinched, meaning that it doesn't have a good nerve supply. So we need to fix the neck to get this working better, okay? Sometimes this muscle is weak due to a nutritional deficiency. Maybe there's not enough minerals in the body, okay? Or there's a vitamin deficiency. Sometimes this weakness is caused by a chemical or toxin exposure. You know, think like a poison. Makes sense, right? Even things like emotional stress or trauma can cause weakness. So basically, in my line of work, what I do is not only do I evaluate the neck to make sure everything's lined up where it should be, I also want to test the muscles in and around the neck. The front neck muscles, side ones, back ones, all the ones for motion, movement, stabilizing. I want to make sure they are working properly. If we find anything that's not working well, we want to ask the question why and work to get it working better. You need muscles to support your neck. If something's too tight on one side and too weak on the other, we have problems. So that is a big part that we focus on in our clinic with neck rehabilitation. So this may include basic things like muscle stripping, going into myofascial work, specific things along with adjusting. We may also be using acupuncture points and meridians, different reflex points. Sometimes we'll use appropriate nutrition or supplements as necessary. Sometimes doing even emotional work and helping with stress reduction and emotional releases. So basically, these are all factors that can affect neck pain and headaches, whether it's a big injury, stress, even a nutritional problem, food allergy or sensitivity. All these things can affect neck pain, and they're things we want to just keep in mind. Now, if you're wondering, you're like, well, I have neck pain and I don't know which one it is, that's what we're here for. I would love to work with you. You can simply call our clinic. I'll have all the info below, and then we can work with you and help you figure out what's going on, and most importantly, help you feel better. That would be our goal here. All right, well, thank you for listening today. If you have any questions, feel free to post them below. Have a great day.